I've been around a long time and working in public health, both as CNN medical correspondent and later as a communication strategist with the U.S. Centers for Disease Control and Prevention. I've been in public health a long time. The people that I work with are, for the most part, brilliant, competent, highly committed, dedicated, and idealistic. They know what they're doing, and the advice they give is intended to promote good health for as many of us as possible and with as little risk as possible. Has the public health community made mistakes? Well, I think they have, of course, with respect to COVID in particularly. The COVID-19 pandemic brought about a whole set of challenges, and the public health community did not always operate uh, prudently during that time. Well, all of a sudden now, years after the pandemic has subsided, we have politicians who have taken advantage of those momentary lapses and used them to wholly and wholesalely discredit the public health leadership. And with it, a good deal of the advice upon which our well being fundamentally rests. Vaccine critics abound all of a sudden, in large part because of the confusion being sown by these opportunistic politicians, including some in high leadership in the U.S. Public Health Service. This is a dangerous situation, and it makes it necessary for us, although we always bear this responsibility, but now more than ever, to be thoughtful, prudent, and cautious in accepting wild claims that seem to come out of nowhere. And that's really what's happened here. We know, for example, that fluoridated water prevents uh, tooth decay. It cuts down greatly on the incidence of tooth decay. But all of a sudden, unwarranted distrust in fluoridated water, is causing municipal water systems to take the fluoride out. Well, that's probably not going to kill anybody, but it certainly is going to make a lot of dentists wealthy because fluoride works. More serious is the vaccine skeptics, the skepticism that's being promoted by these same people. We know that vaccines reduce the severity of illness and, in many cases, prevent illness altogether. In fact, have even eradicated some diseases and put us on the verge of eradicating others. If we undo that, we are going to have more disease as a result. Vaccines work, and politicians who say otherwise are being not only short sighted, but really quite selfish in putting their own interests and axes to grind above the public welfare. It is important now more than ever for individuals to think prudently about what vaccines have done for us and indeed what the public health leadership has done for us in the past and the promise of them to continue to do that going forward. This is important enough for me to state it in this video, whether, again, it's seen now as I record in the fall of 2025 or years later. Trust can be regained where it's lost, and that's an area where I can actually help the public health community in regaining the trust they've lost. But in the meantime, to everybody, understand that they are worthy of the trust based on a stellar record that goes far before COVID and extends far after it. Keep that in mind, please, before jumping to hasty and dangerous conclusions. Thank you.